Hello everyone, I'm Kote. Today we're gonna talk about infarction. What is infarction? Infarction is localized necrotic area, necrotic tissue. When it's localized, it's infarction, and it is called infarction site. Infarction is caused by hypoxia, and hypoxia is caused by ischemia. Hypoxia is deficiency of oxygen, and ischemia is abnormal blood supply. Ischemia. Hypoxia and ischemia are main factors of progression infarction. Which organs are most common sites of infarction? Most common sites of infarction are this organ which has which tissue cannot survive a long time without blood supply and without oxygen. This is heart. Heart tissue can survive without blood 10-15 minutes. Brain, second most common site of infarction. It can several minutes. Intestine, kidneys, lungs, and infarction may progress to any internal organs. It may be pancreas, maybe spleen, maybe testicles and other organs, but it's less common. Most common cause of infarction is ischemia of heart. Number one is heart infarction. Okay. Infarction tissue is its gross anatomy is wedge shape. For example, if it's kidney, and if here is infarction site, it will be wedge shape. The apex of this wedge is pointed where blood supply is stopped. Here will be emboli or thrombi, and this is infarction site. Wedge shape, very important. Most common infarction is looks like wedge shaped. Okay, infarction may be pale, anemic, or hemorrhagic. Pale will be when there is one artery blood supply, one artery. If we have one artery and we will block this one artery and cut off blood supply, at this case we will have pale anemic infarction. For example, heart, kidneys. We have hemorrhagic when we have collaterals. hemorrhagic infarction when we have collaterals, for example lungs, brain. And in microscopic pathology, we may have two types of infarction. It will be coagulative necrosis. Why coagulative? Because at this case here is accumulation of fibrin. And liquefactive necrosis. Liquefactive will be in case of when necrotic tissue contains enzymes, and when these enzymes are released, at this case we have liquefactive infarction. But most organs infarction are coagulative necrosis, not liquefactive. Most common is coagulative necrosis. Coagulative necrosis is most common. So let's summarize our topic. Infarction is localized necrotic area of the tissue. Infarction, most common cause of infarction is hypoxia. Hypoxia is caused by ischemia. Most common site of infarction is heart, then brain, then lungs, intestine, kidneys. Most infarction are wedge-shaped. Infarction may be pale, anemic, or hemorrhagic. It depends on blood supply. If it has single artery blood supply, it will be pale. If there is collaterals, at this case it will be hemorrhagic. Microscopic growth may be coagulative necrosis. In most cases there is coagulative necrosis and liquefactive infarction. Liquefactive is caused by enzymes. When enzymes are released of the dead tissue, it becomes liquefactive, and it's in case of pancreatic infarction and brain. Thank you for watching. Please subscribe my channel and please like videos. Thank you very much. Bye.